Prevalence estimates vary, but data from both Department of Defense DoD surveys and Department of Veterans Affairs VA screenings illustrate its scope. Women versus men. About 1 in 3 women veterans and 1 in 50 men veterans in the VA healthcare system report experiencing MST at some point during service. Military sexual trauma, PTSD, National Center for PTSD. Women are at greater risk by percentage, but because men comprise a large share of the military, approximately 40% of veterans who disclose MST to VA are men coping with MST, symptoms and VA benefits, or what is MST. In active duty populations, an official survey in 2018 found 6.2% of active duty women and 0.7% of active duty men had experienced a sexual assault in just the prior year. Military sexual trauma, PTSD, National Center for PTSD. This underscores that while women face the highest risk, MST affects all genders. And trends. Recent DoD reports show that sexual assault rates have increased despite prevention efforts. An estimated 36,000 service members experienced sexual assault in a recent year, an approximately 80% jump from about 20,000 in 2018. Military sexual trauma, the military's silent battlefield or Columbia Social Work Review. By contrast, 8,942 sexual assaults were formally reported in FY 2022. Military sexual trauma, the military's silent battlefield, or Columbia Social Work Review, indicating that many incidents go unreported. The gap between estimated incidents and reported cases highlights ongoing underreporting, likely due to stigma and fear of retaliation. LGBTQ+ and other intersectional factors, certain groups experience disproportionately high rates of MST. Sexual minority service members have elevated risk. For example, one large study found 22.7% of bisexual, pansexual, and 17% of gay lesbian veterans reported a history of MST, compared to 6.5% of heterosexual veterans. Military sexual trauma and its association with mental health among sexual minority and heterosexual veterans in the United States, or LGBT health. Transgender service members are also at higher risk of MST than their cisgender counterparts. Military sexual trauma, PTSD, National Center for PTSD. MST affects service members of all races, ranks, and eras, though younger and lower-ranking personnel appear to be at higher risk, likely due to power dynamics and reporting barriers. Military sexual trauma, PTSD, National Center for PTSD. In short, MST cuts across demographics, but women and LGBTQ+ service members face especially high vulnerability. Updates on VA policies and procedures for MST. VA disability claims for MST. In recent years, the VA has implemented changes to better support MST survivors filing for disability benefits. Notably, the VA has overhauled how MS-related claims are processed, including enhanced training for claims processors and specialized procedures. For evidence review, Military Sexual Trauma and Disability Compensation, or Veterans Affairs. If a veteran previously had an MST-based claim denied, the VA now actively encourages them to seek a review under the new process, Military Sexual Trauma and Disability Compensation, or Veterans Affairs. The goal is to ensure claims are handled with greater sensitivity and accuracy, given that MST survivors often lack formal documentation of the trauma. For PTSD or other conditions due to MST, the VA accepts markers like behavior changes or confidant statements as evidence, in lieu of official reports, to substantiate claims. Military Sexual Trauma and Disability Compensation, or Veterans Affairs. Military Sexual Trauma and Disability Compensation, or Veterans Affairs. Despite these improvements, a surge in MST claims has led to significant backlogs. In late 2023, the VA faced a backlog of roughly 20,000 MST-related claims, even after consolidating MST claims processing at a specialized office. Disability Assistance and Memorial Affairs Chairman Luttrell leads hearing to examine VA Benefits Claims Management System, or House Committee on Veterans Affairs. By early 2024, The backlog had grown to over 26,000 pending MST claims. Disability Assistance and Memorial Affairs Chairman Luttrell leads hearing to examine VA Benefits Claims Management System or House Committee on Veterans Affairs. With many cases waiting well beyond the 125-day decision goal, military sexual trauma, the military's silent battlefield or Columbia Social Work Review. In response, the VA stood up additional surge teams, for example, designating a special processing unit in Roanoke in April 2024 to expedite MST claims decisions. Disability Assistance and Memorial Affairs Chairman Luttrell leads hearing to examine VA Benefits Claims Management System or House Committee on Veterans Affairs. These steps, along with ongoing quality monitoring as recommended by the GAO, aim to reduce wait times and ensure survivors receive the benefits they are entitled to. VA healthcare support for MST survivors. The VA provides extensive, free support services for veterans who experienced MST. Every VA medical center has an MST coordinator on staff to assist survivors in accessing care and navigating resources. Military sexual trauma treatment and veteran support. Mental health. All treatment for physical and mental health conditions related to MST is offered at no cost to the veteran, regardless of when or where the trauma occurred, and even if it was never officially reported. Military sexual trauma treatment and veteran support. Mental health. Military sexual trauma treatment, veteran support, mental health. Importantly, eligibility for MST-related care is very expansive. Veterans do not need a VA disability rating or service connection for MST to get care, and even those with other than honorable discharges may qualify for MST services. Military sexual trauma treatment and veteran support, mental health. In fact, survivors are not required to provide any documentation of the incident to receive care, and they can simply say they want to talk to a healthcare provider about mental or physical health issues without disclosing details at intake. Military sexual trauma treatment and veteran support, mental health. The VA's MST services span both mental and physical health. Outpatient counseling for MST, individual or group therapy, and medication management are available at every VA medical center, as well as many community-based clinics. Military sexual trauma treatment and veteran support, mental health. Every facility is mandated to have providers trained in MST-related care, and many have MST-specific treatment teams or support groups. Veterans can also request the gender of their clinician, male or female, if that helps them feel more comfortable in therapy. Military sexual trauma treatment and veteran support, mental health. For those with more severe or complex trauma symptoms, the VA offers specialized residential and inpatient MST treatment programs, some of which have separate tracks or housing for women and men to ensure a feeling of safety. Military sexual trauma treatment and veteran support, mental health. Additionally, veteran peer support specialists are often available to work with MST survivors. These are fellow veterans, many are themselves survivors, who are trained to provide mentorship, hope, and coping strategies as part of the recovery team. Military sexual trauma treatment and veteran support, mental health. The VA can also authorize community care coverage for counseling outside the VA, if needed. For instance, if a certain specialist service is not available locally, or if the veteran would benefit from a non-VA setting. Military sexual trauma treatment and veteran support, mental health. Overall, recent VA policy changes reflect a trauma-informed approach, streamline claims, expand training, and lower barriers to care so that MST survivors are believed and supported rather than re-traumatized by the system. Treatment options for MST survivors. Healing from MST can be a long journey, but a variety of evidence-based treatments and supportive services are now available through the VA and other providers to help survivors recover. MST itself is not a formal diagnosis, it is an experience of trauma. So treatment is tailored to the specific mental or physical health conditions a survivor is facing. For example, PTSD, depression, anxiety, substance use, chronic pain, etc. Military sexual trauma treatment and veteran support, mental health. The VA emphasizes personalized, veteran-centered care, Survivors can engage in therapy at their own pace and choose from multiple types of treatment based on their comfort and needs. Some key treatment modalities and programs include trauma-focused therapies for post-traumatic stress disorder, PTSD, and related trauma reactions stemming from MST. The VA widely offers evidence-based psychotherapies. The most effective treatments for MS-related PTSD are similar to those used for other trauma PTSD. They include prolonged exposure PE therapy, cognitive processing therapy CPT, and eye movement desensitization and reprocessing EMDR. In PE, patients gradually confront PTSD symptoms like nightmares or hyperarousal, depression, anxiety, or